schema therapy is very oriented towards state. And if you think about it, a state involves the body, of course, and an obvious aspect is, how do I perceive my body? What do I notice in my chest or my belly or whatever, if I give attention to that? But we can introduce a more important and complex aspect of the body, and that's, how am I organizing my body? What am I doing with my body? And we all tend to be so little aware of that on the one hand, and it plays such a big role in how we ourselves are managing the state, and, of course, in an interaction context that has even more implications. Once you begin to understand some of this particular perspective on it all, then you can look at what you can learn and expand in your skills and abilities as a therapist. And this will include aspects about noticing more your own, what you're doing with the body. And secondly, this is quite different, noticing in more detail about exactly moment by moment what the patient is doing with his or her body. And thirdly, critical and key, what is the moment by moment interactive influence? So there's my side, there's the client's side, and there's the back and forth between us. Three big areas that one can learn so much more about, and it's good for our skills, but even more important, it's rather fascinating.